Hey, it's Dr. Goldie Jacques-Mains here. I'm going to talk today about spinal hygiene. So what is spinal hygiene, you're wondering? This is something I talk about with patients all the time, right? One of the most common things I hear is, man, doc, I am stiff. Right? I've been sitting, I stand up, I feel really stiff and achy when I get up out of my chair, or I wake up in the morning and I feel just like really stiff, but as I get moving and as I feel better, as I get moving and if I stretch, I feel better. So to me, that indicates that you need spinal hygiene. You need movement, you need some stretching and mobility in your spine. We all know how important good dental hygiene is, right? The dental industry is fantastic at teaching us why we need to brush our teeth twice a day, why we need to floss our teeth twice a day. But I think the chiropractic profession can probably do a better job at telling people why they need to take better care of their spines and why spinal hygiene is so important. Imagine a pet. Maybe you have a cat, or maybe you have a dog. Maybe you don't have a pet, but you've seen pets before. When that pet's been sitting or laying down on the floor and they're ready to get up, what do? They stretch, right? That dog is gonna put his hands, arch his back. He's gonna do a really nice spinal stretch. My cat, every time she gets up, she stretches. Most animals have this instinctual habit of stretching their spines after they've been still. We don't have that habit, right? We go to our desk jobs, we sit all day, maybe we spend 3-4 hours at our computers nonstop, and we get up and we just go and we go, oh, the stiffness, right? So stretch. You get up, take your time, touch the floor, arch your back. One of the most common ways that I tell people to go ahead and move their body would be a yoga routine, right? A morning sun salutation routine. So this is very simple exercises. If you need more instruction, please find a local yoga class, call your chiropractor, get some tips, all right? So number one, you want to arch your back, right? Arching your back is great spinal hygiene, okay? You want to bend forward. You want to keep the spine nice and straight, chin up, stretch those hamstrings, right? Bend forward, touch your toes, stretch your back. You can go backwards and do extension. You want to do this nice and slow, but you want to slowly try to bend forward, try to bend backwards, okay? You want to stretch sideways, okay? Holding these stretches, feeling the body lengthening along those stretches. A general rule of thumb is if you're just starting getting stretching, you certainly don't want to go into pain. Don't ever train into pain. Try and hold it for 2-3 breaths at a time. I think it's really good to do a hip stretch, right? So this can look like a lunge, maybe. You can see if I can do it from the side. Lots and lots of wonderful ways to stretch your spine. Lying on your back, bringing your knee to your chest, right? Twisting is another really important stretch. So for good spinal hygiene, I recommend several times a day, bending forward into flexion. Bending, extending backwards into extension, lateral flexion, side to side, rotation, right? Your spinal segments want to move, they want to groove, they want to just feel alive. And when you sit still and you don't stretch your body, you're going to feel stiff and achy, all right? So hope that information's helpful. If you liked the information, hit a nice little like button, write a comment, ask me a question. Appreciate you. Thanks so much for watching. Bye.